Hi, my name is Dr. Michael Wilkes. I'm a professor at the University of California at Davis and spend a good portion of my time working in global health in East Africa, in Asia, and Central and South America, and spend a rest of the portion of my time involved in medical education, teaching medical students and residents and looking at how to change doctors who are practicing in the community. I've spent a lot of my time in research looking at doctors' behaviors, looking at what goes on between a doctor and a patient and the communication that goes on, and looking at what a patient needs, what they want, what they expect, and looking at where a doctor's coming from, what their agenda, and how we weigh science and patient satisfaction to get this sort of combination of excellent health. There are some things that worry me about the way medicine is currently practiced. One of them is the profound conflicts of interest. And, it's easy to think of conflicts of interest coming from manufacturers of food products, manufacturers of drug products, manufacturers of medical and surgical devices. But we also have to worry about conflicts of interest on the part of medical journals, on the part of academic institutions. We tend to, at least in my world, think of the academic institution as being this shrine that, we couldn't possibly have interests other than what's best for the patient. But, we've grown to the point where our academic institutions, be they public or private, are biomedical industrial complexes, and they're profit generators. And what they do is more often than not what's in their best interest, not in the best interest of the community, the patients, or sometimes even the faculty. In medical education, we often talk about African Americans and Latinos and Buddhists and Muslims and Jews, but we rarely talk about the culture of our profession, which, if you look at what defines a culture, there are rituals and uniforms and hierarchies, and be it the Catholic Church. Well, if you apply that to medicine, we have our own culture, right? It is its own culture. We speak our own language and have our own words, and there are short white coats and long white coats, and assistant professors and associate professors. Anyways, it meets all of the criteria. And then I got into trouble because I was a researcher. I was a part of the brethren now. I wasn't an outsider, but I thought like an outsider. I was very critical of how we treated our medical students, how we selected our medical students, how we propped them up and provided wellness services or didn't provide wellness services. And began to question that, and it was a very difficult road. The prostate debacle all happened at a time when I was writing regularly for McClatchy newspapers, and I always had my wife read my columns, and I didn't have her read that one. And she goes, "Well, why that one did you not have me read?" And I said, "Well, because I think I knew you would have said no, and I didn't want to be stopped by that." And she suffered greatly, as I have, as a result of that. And again, in all of that process, where people accused me of all of these things, nobody ever questioned my science. Nobody ever said he was wrong. It was, did you have a right to question the university? Did you have a right to challenge the way we were spending our money and the way we were promoting our services? So nobody ever said to me, you're wrong, or you're misleading, or you're taking money from this company or that company. Nobody ever questioned that integrity. And I think perhaps the reason that things came out the way I did was because it was clear that I was questioning the institution and not that I was some crazy guy, looking at science in a different way or spinning this a different way. At the time, I was the chair of this task force at the Centers for Disease Control. My research was all funded by the National Institutes of Health. I was hardly a crazy guy that was off saying something that didn't have any credibility. I do watch my tongue a bit more. I'd say that instead of having my wife read 75% of what I do, I now have her read 95% of what I do. I think if I wasn't beholden to the academic institution, I'd be a little bit more freer. I think, this whole idea of challenging the academic castle, this fiefdom of academia, no one's really done that. And, it's the hand that feeds me, and I'd be disingenuous to challenge it. But, academia has gotten a little bit corrupted, or perhaps substantially corrupted by its incestuous drive for money and profit and bigger buildings and more and more and more. And we've sort of lost the path of what we're really about, which is truth and discovery. And at the end, not these surrogate things. We don't want money for research. What we want to do is to find the answers to questions that are going to make people healthier and happier and live longer. And we've gotten off that beaten path a little bit. The question I get asked occasionally is would I do it again if I had the chance? And knowing what I now know, again, not about the science, but about what would happen to my career. And I think the answer has to be that I would. I would take a much deeper breath, and perhaps have gotten a body trainer and done the cognitive or cerebral equivalent of bodybuilding, and figuring out who I am and what I stood for earlier. But I probably would have done it again. But a week or maybe a month doesn't go by that there aren't similar issues, and no one's willing to take a stand on these issues, and or few people are willing to take a stand on the issues, and it's because this. We know what happens to whistleblowers, and it's a closed community, and you've got to be really careful, or independently wealthy, or work for an organization like the McDougall or Pritikin, or some organization where you don't have to worry about being able to challenge. And maybe the answer is that I really missed my career. Maybe I should have stuck with journalism. But even journalism, we won't go into that now. But I've had my hand slapped for, questioning a sponsor or questioning someone who was one of our major sponsors, and so there's no perfect world. Is it better than lots of places in the world? Absolutely. Is academia doing nothing good? Of course not. Academia does enormous amounts of good, and our students are amazing. And could they be better? Of course they could be better, and we're working hard to make them better. But it's a work in progress. And in the morning, when I get up in the morning, I feel good that I get to do two things. One, I get to be with students and residents, which is amazing in and of itself, and secondly, I get to be with patients that are putting their trust in me. And I sometimes need to pinch myself and say I'm actually getting paid to do these two things. So I feel blessed at the end of the day.